And we're off now, so I'm going to Google some images of trout pouts to educate Phoebe.
Thank you very much.
And Phil Mitchell.
And Phil Mitchell, yeah. Phil Mitchell with a trout pout. Now, there's an image. Welcome to the Joy Tuck Club, the podcast that celebrates the beauty and diversity of transgender individuals and identities. I'm Rachel, my pronouns are she, her, and with me is my wife and co-host, the beautiful Phoebe.
Oh wow, also she, her.
What are we doing today, Phoebes?
It's a good one. We're softening our jawline, plumping our cheeks and accentuating our cupid's bows as we talk with aesthetics practitioner Dr. Oli Curwen about injectable facial treatments that can masculinize or feminize just about anyone in mere minutes.
Oh, excellent. I wouldn't mind a bit more of a draw on my cupid's bow,
right?
But without having to draw it on myself with a lip liner.
Yeah.
Hey, I hope this interview isn't all filler and no killer.
Actually, there's tons of filler, but don't worry, it's the dermal type and it's applied in all the right places. Does mean, though, that there's a risk this episode will dissolve in about 18 months.
And also, you know I'm not a fan of needles.
Well, you don't have to worry about that. Dr. Oli talks about needle phobia. It's quite common, and he's got a lot of good tips for how to deal with needles in just about any situation.
Oh, that's good to know.
And we'll find out the treatments are a less intrusive, more budget-friendly way to align your external image to your internal, rather than surgery.
Or a way to try out different looks and aesthetics before you take that plunge and go all in on surgery. And as he tells us, the treatments are temporary and can be undone quite easily with instant results.
Yeah. The point of all of this is to deliver natural-looking results that help you look like you, but on a really good day.
And much like facial team, the approach is to keep it natural and kind of try to roll back the unwanted effects of the wrong puberty.
Yeah. So that's enough of an intro. Shall we get into the interview?
Sure. So just sit back, relax, and focus on your desired outcomes.
Hello, Dr. Oli. Thank you so much for joining us.
Hello, it's lovely to be here. Thank you so much for inviting me.
Now, I should explain in advance that we're all a bit croaky because we've all had colds. Presumably different strains, but who knows?
Well, yours is the same as mine, I'm sure.
I hope that's a given. We've got a number of questions to ask you about what you do and how you help the trans community by doing so, which is really exciting. Can't wait to hear it all. Why don't you start off with a little bit of background? Tell us a bit about yourself.
Yes, absolutely. So I'm Oli. I trained as a doctor in London, graduating in 2018. Since then, I've been training in the NHS to be a surgeon. So I'm still on the training pathway with the goal of becoming a colorectal surgeon. A few years ago, I decided to go into the world of aesthetics as well. To begin with, it was a bit of a side hustle, a bit of an extra money maker. As I'm sure you've seen NHS doctors in the news don't feel like they get paid enough. Mm-hmm. So I thought I'd make it a little extra living. And then discovered I actually absolutely adore the field of aesthetic medicine. It's a mix of science, it's a mix of art. You meet all kinds of people, and I've slowly been working up and building up a patient base. And then over the last year or so, I started meeting more queer patients that came to see me who at first came organically to me as a place where I very much advertised being part of the LGBTQ plus community, having a safe space, a place that people don't need to explain their backgrounds to me. We just are people chatting, and if I can help you look a little bit more like who you feel inside, great.
Sure.
And so over time, I've actually been working more and more with trans patients, and it's just incredible. I love it. So that's a little bit about me.
So within your background in surgery and aesthetics, does your surgical training inform your approach to aesthetic treatments? Does it give you a different perspective, maybe?
Yes, I think so. Firstly, surgical training is rigorous. It's very much, You must know anatomy. You must be able to explain procedures. You have to be able to do procedures, treat complications. So it's given me a really good foundation to actually start doing something like aesthetics. Unfortunately, in the UK, it's a little bit of a minefield who you see and where you go, and it's not very regulated as an industry. So you could get your hair and your nails done and also get some filler at the same time if someone's done an online course for 20 minutes, which is frankly terrifying.
A little bit. Wow.
Yeah. And so...
But where can I get them?
Yeah, exactly. But I think because it's available, we need to sort of improve education about that anyway. But then for me, I operate all the time on much more complicated things than doing a little bit of filler, which actually means that I then have the confidence to know that if anything were to go wrong, I can deal with it and I can sort it out, and we can communicate in a way that is beneficial to everyone as well. So a surgical background has meant that basically it's quite relaxing for me doing this kind of treatment, because I know that actually the day job, as it were, is significantly more complicated, significantly more devastating if things go wrong. And so actually this is relaxing for me, and hopefully patients feel the same way.
Oh, I really like that. That sounds kind of ideal, doesn't it? So Rachel refers to her current job and this as other work, and we wish it were the other way around, but doing things that way sounds really, really good. You mentioned becoming aligned with the trans community, and you are part of the LGBTQ community, right? So what specific treatments do you offer for feminization and masculization? How does it work? What do we take? What does it do?
It's a good question. The very easy, quick answer, before you look at my website, the very quick answer is we treat everyone individually. So if somebody comes in and asks for a treatment, it's not really about masculinizing or feminizing. It's about what you want to change about your own face. And so we know that gender is a spectrum. So actually, I find while the terms feminizing and masculinizing are useful as sweeping statements, actually, it kind of makes me a little bit uncomfortable, because it's just about a person who might want to change a little bit about their face, and who's to say that these lips are masculine and these lips are feminine. It's about finding what works for you and what works for your face. But going back on that, it is easier to categorize them into masculinizing and feminizing treatments. So for feminizing, in general, we're looking at softening features. We're trying to go away from square and we're going towards oval or heart-shaped. So we focus on the cheeks. We make the chin small and dainty, as it were. We've changed the lips to make them a little bit more, again, heart-shaped, bump. And we are sometimes changing the nose a little bit, tweaking it, making it look a little smaller, or giving it a little bit of a pixie tip so we can lift the nose edge a little bit. So that's feminizing. We've got lots of things we can do for that. We can use a mix of Botox injections, so that slims muscle. So over time, we can reduce muscle bulk in the face, but also fillers as well, changing the shape.
Can we come back to the nose?
Yes.
Because I'm curious, how does it work? There's no muscles there, are there? How do you make your nose more pixie-shaped? How do you lift the tip? What do you do?
Absolutely. So that's using filler. So what we can do, I mean, it's slightly uncomfortable, is actually putting filler right behind the back of the nose, so we can push the entire nose up and away. So while we can't make a nose smaller, absolutely, we can lift the tip and we can tweak it to give it a little bit of a ski jump, which people typically see as a slightly more feminine nose. And filler is all about how it's changing how light reacts on the face. So while we can't make something smaller, we can make it look smaller by changing how the shadows work, how the light picks up certain features. Honestly, it's a really fun procedure to do because the results are instant. And you come in with one nose and you leave half an hour later with a different one.
That sounds great. What other differences are there? I'm aware that there's a difference in, generally speaking, in the height of the cheekbones. And to explain that, as you were referring to before, it's difficult to categorize everything as masculine or feminine because it doesn't work that way. Nothing's binary here. But we do have the bell curves and a very significant overlap between them. So is it true that what might be feminizing on one person's face might actually turn out to be masculizing on another's?
Yes, definitely. Absolutely. And I think this is why it's so important to actually have a really good long conversation before we do anything. So, I mean, when someone first comes in to see me and we want to start a treatment plan, we spend 45 minutes, just patient, me, a few mirrors, and we just talk. And over time, I'll eventually be drawing all over my patient's face with an eyeliner pencil as we mark up. Oh, do you know what? I actually love it. It's like painting on a canvas. It's so creative, and we go, well, actually, for you might have really strong cheekbones genetically, and how do we turn that into an advantage rather than something saying, oh, well, that's not classically masculine or classically feminine. And so we work with the structure and we can change things and tweak, and it's entirely dynamic, which is why there is no one size fits all in terms of we want to look more feminine or masculine.
That's interesting. It sounds very much like your treatments are a cheaper, less invasive alternative to facial feminization surgery. But how do your treatments compare to FFS? Do you see them as a replacement, or are they there to complement FFS?
That's a really good question. They are an alternative, but they can also complement. I do recommend, before going down the route of FFS, is maybe trial aesthetics, play with filler, see actually what you like about your face. And for one thing, it's significantly lower in cost. I mean, we look at some of this surgery that can cost upwards of £30,000, when actually, is that much surgery necessary? Do we want to use some fillers? And I've also got some patients that, do you know what, we trial a bit of filler, we change the chin, we change the nose, and then they go, do you know what, this is the shape I like, so this is what I'm going to have surgery for. So it's a really nice trial run. It doesn't affect surgery. It doesn't mean that you can't have it. So in one way, it's really nice to experiment a little with your face, get to actually know what your face is like before we start changing it in a more permanent way, let's say. Another thing is that fillers and aesthetics are adaptable. And for me, that's really important, that when we see some of my patients starting on hormone treatments, their faces change so drastically. At what point is permanent surgery good if your face is constantly changing? So actually something like filler, we can adapt, we can dissolve, we can add more. And as your face and your physique changes, we can change with it. And for me, that's really important. It's about adaptability in a place where actually the goalposts are always changing. Also, I mean, faces are fashionable. They come and go. Some people like lips there one way and then a chin the other, and then different models come out, TV changes. It's quite nice to be able to tweak as we go along. Yeah. Also, people age. I know we hate talking about aging, especially in aesthetics, but as people age, we want to be able to change face shape. And so our goals with fillers can also change, and we want to keep people looking fresh, but not necessarily stuck in time.
Now, how would you then address something like the supraorbital reduction, forehead type 3, brow ridge? How do you achieve something like that with your type of treatments?
That's a good question. There's definitely a limit to what I can do, because with Botox, I can slim muscle. So actually, where people have a heavy brow, that's made of thick muscle, we can slim that with Botox, and it does take a while, but it works really well. Sometimes there is no place for my role. There is no place for filler. There is no place for Botox. And at that point, surgery is indicated. And that's where I think we can complement each other quite well, is that as a surgeon, but also as an aesthetic doctor, I can see where my limits are and actually go, do you know what? That's something that we focus on in surgery. But while you focus on that and you save up however many thousands of pounds for that, what else can we do in the meantime for a tenth of the price?
So coming back to the idea that aesthetics and surgery can complement each other, you're the Venn diagram with the big overlap in the middle. And you also suggest that one can use aesthetics to experiment beforehand, right? Model, you're putting the plasticine into plastic surgery.
Yeah, absolutely.
But you also see them going hand in hand where one can be planned alongside the other. For example, Facial Team offer this. They offer a range of injections, but not probably the full range of what you do. Do you think there should be a closer collaboration of some kind?
I think collaboration, to be honest, anywhere in healthcare is important. It's so beneficial because it means that actually I can learn more about, say, the Facial Team. They're excellent. Their work is wonderful. If we collaborate more, all we're going to do is benefit the people that come to see us. And so we go, well, actually, we can try this, we can try that. I mean, I've got a patient at the moment that she had her face scanned at the Facial Team, and they said, well, actually, you don't need to change anything because our system has said that you have a feminine bone structure. And she's come to me and she says, well, I'm not really that happy with that. And so it's one thing going down a surgical route, one thing going down an aesthetic, and it's a little bit about, yes, collaboration, but also understanding of what we can do. And I think from a surgery background, I know what they can do, but maybe they don't know what actually tiny tweaks and fillers change about people's faces. One thing to say is that, I mean, surgeons globally have a bit of a rep of maybe not being the best talkers, the best communicators. Surgeons are very closed-minded, yes, I can operate. And I think introducing more conversation and more of a holistic overview is incredibly important as well. So I guess that's where I see as myself being slightly different from other surgeons, is that I love chatting. And actually, we just have a conversation, and a patient is also just a person. And it doesn't matter what the objective signs of things like scans that the Facial Team do. It's about what can we change that when you look at yourself in the morning, you go, yeah, I look good.
So you can have injections at any stage. They're not going to interfere with surgery, but would you need any additions dissolved, for example, before someone starts remodeling your jawbone?
I would say yes, to be honest. I think I've had a couple of patients, again, that we've done a little bit of filler ahead of going to somewhere like Spain to have their surgery. It's not required. I just feel a little funny about people planning for surgery based on a product in the face that is going to dissolve. So it's not required. The filler doesn't get in the way of surgery. It's not going to change things like infection risk. But I do think it changes the mindset of the person doing the operation, because they are seeing something that in 10, 12, 18 months' time isn't there anymore. So I tell all my patients that if we are going down the surgery route, we do the filler, we take all the pictures, you last up until we're ready to go, and we'll come back and dissolve it.
Right. Okay, that makes sense.
So on your website, and I know when we had our little pre-interview chat the other day, You mentioned that you get reduced prices for transgender patients through Millennium UK. Can you give us a few more details on that?
Yes, absolutely. So I've been working with Millennium, that are a Canadian-based filler company. I've been working with them for probably about 18 months or so now. And I first started using their products because they made some promises about how good the product was. And they came to see me, and it was a slightly new product on the UK market, but been used in Canada for years. And so fillers, typically our problems as practitioners is that fillers cause swelling and they cause pain. The results aren't always instant, and they can take a couple of weeks to sort of swell, go lumpy and come down. And Millennium came to me and said, we've got a filler that doesn't swell. We've got a filler that works really nicely. It feels nice in the hand to use and inject. Do you want to use it? So I tried them out, and they actually were wonderful. So moved to using their product. And then I started getting my trans patients coming to see me, and having an awareness of how much trans healthcare costs has only really given me fire in my belly to try and make these services as affordable as possible. And so I then went back to Millennium and said, what can you do for the community? What can you do to help these people that are spending thousands and thousands of pounds on talking therapies and hormone therapies and trying to find an NHS GP that can help them? And then they're also saving up for surgery in many different aspects. What can we do to work together to make this cheaper? And so Millennium took a little while before they sort of said, well, yeah, let's support you. And so we have a slightly dynamic pricing, I would say. It's not as clear cut as I can give X percentage off a treatment, because it sort of depends on how much of the filler I order, what percentage of that I can use for trans patients. And that's why I've not put any prices on my website. It's a little bit more along the lines of, the more treatments we do, the cheaper overall it becomes per unit cost. So there are some patients that I've actually managed to get things like a sort of a 50, 60% discount, and some 30%. And so I will always see my patient. We have our consultation. We come up with a really good plan. And then I go to Millennium and go, I've got this amazing patient. This is what I want to do for them. What can you do for me? And so, I mean, even one time the rep said, well, why don't we see this as a training session and we'll give the treatment for free? And we did. So it's dynamic. I basically want to take the cost down as much as I can, but also in this world, it is a business as well. So I need to make sure that we're not losing money. So there is a cost associated with it. I won't pretend that treatments are cheap, but they are affordable, and I'm hoping to introduce things like payment plans as well, just to make them that little bit more accessible as well.
It's nice in this current climate to see a company that's throwing its weight behind trans people and actually helping them rather than punching down on them. So it's a sliding scale on a case-by-case basis.
Yes, absolutely. Yeah. I wish it was something that I could just say, here is my separate price point. Maybe over time it's something I can do if I work with maybe more practitioners as well. At the moment, I work for myself. And if I can start getting a service up and running across other practitioners, then we're buying more filler in bulk. We're seeing more patients, in which case then we can maybe formalize it into something a little bit more transparent, I guess, in terms of pricing strategies.
That's definitely something we've seen. We've done quite a lot of interviews with gender-affirming healthcare professionals, and it's a theme that's running through. I think most of them recognise what we call the trans tax and how expensive it is to transition. And yeah, it's nice that people are pulling together to try and bring that cost down for us.
So when we talk to other providers in your industry, should we suggest them to get in touch with you to create a buyers group?
Yeah, absolutely. I would love that. It's something that, number one, as a practitioner, I know what I can do and what I can't. And I think coming up with this service, it's not very well advertised. And there aren't many practitioners that will, as openly as I do, sort of say, here are my gender affirming treatments. Here's what I can do with cost. Um, I've got some people who are interested across the UK to sort of go, oh, what can you do? Maybe I can go and train them in the way that I actually do my procedures, how I assess people's faces. So that's one thing is training. But other practitioners who are doing it, absolutely, please do get in touch with me, because I think, again, collaboration is only going to benefit people. It's going to make my clinic busier, their clinic busier, but it also is going to give a person way more options of looking and feeling better.
Theoretically, given you mentioned earlier, you can do like a 20-minute course and suddenly you're a practitioner. You could train someone within the community who could go out and train. Is that how it might work? Like just keep spreading the knowledge, or does it become diluted, or there's too much danger in it?
I wouldn't want to train anyone who's not a doctor. I would say it can go wrong. And if it goes wrong, it can be really quite devastating. So I would only train doctors or healthcare professionals in doing these procedures. Having said that, I'm also a little bit of a perfectionist. And so even someone who says, I'm a doctor and can I do this? I'd still want to sit down and see how they work, see how they communicate, and make sure that they represent a service that I think I am providing. And so I think I would be quite hands-on. I'm quite type A, so very, very hands-on in developing a service before I would put my name to other people's work, or allow them to work with me. I want to be really strict to make sure that actually the care that we're providing is excellent care. I wouldn't want that to become diluted over time.
Well, I am interested in learning more about your process.
It's effectively a 45-minute conversation of sitting down and drawing and looking in the mirror and assessing structure. And we start from the top of the head and we just work our way down the face and the neck to go, what do we like? Is the number one question. What do we like? A lot of people in the aesthetics industry, your first thing is, why did you come to see me today? And a lot of people then go, I don't like my nose, or I don't like my chin. My way is, what's positive? What are we keeping? What are we emphasizing? So someone, I don't know, last week said, I really love my eyebrows. And it was the first time someone had just gone, no, I love my eyebrows. I went, great. So we're not going to touch them. So what else do we love? What else are we going to emphasize? Are we talking good teeth? Are we talking bone structure? And then we go on to, so when you look in the mirror, what's made you want to see a practitioner? What's made you go, maybe I don't feel quite how I feel inside? And then we go down that route. So it's about focusing on all the positives first. And then we say, what can we do to make those positives even better?
So I'm coming at this from a slightly different angle. Someone goes to a surgeon for FFS and they kind of expect the whole thing to be done. It's finished. The painting, the portrait is complete. And I don't think it actually works that way. Because, for one thing, you can't do everything at once in plastic surgery because it's plastic and it moves and changes as it heals. Right? It's all soft tissues for the most part, apart from the bone work. Well, I guess in cartilage. But
we need to look at a level of broad brushstrokes. Is that those sweeping statements of the masculine and the feminine and what society has told us that those words mean. And so something like surgery is very good at sort of putting you into one camp or the other. And the same goes for sort of heavy-duty masculinizing surgery where actually they're putting implants into the body and improving the structure of the jaw, things like that. I do think that there's a role that provides, and that can be incredibly beneficial. The things that I do, as you said, it's the fine tweaking. It's okay, so we've redone your jaw structure, but what do you think about your lips? When you put lipstick on, do you use lip liner to make your lips look bigger? Why don't we do a little bit of lip filler that actually that's the look you're going for? And these are the subtleties that my work provides. We're not talking broad brushstrokes by any means when it comes to my treatments. It's, in general, we judge everything by a milliliter in aesthetics. When we talk about dermal fillers, everything is priced by the milliliter worldwide, basically. There are some patients that come to see me for new lips, and we do 0.2 of a milliliter. So if you're thinking how much volume that actually is, one single drop of water.
Mm.
But that amount of filler does make a difference. And so this is where we become particularly delicate and focused and precise. And it's the fine tuning, it's putting varnish on the oil painting. The oil painting is there, but this is our little tweaks and adjustments that make all the difference at the end of the day.
But there are also tweaks that have to be redone, right? So what is you mentioned 18 months earlier. Is that about the time between visits?
It depends, is the easy answer. Okay. If we are looking at filler treatments, things like lip fillers last for about a year, 12 months. The fillers that we are using to recreate bone structure, so things like the chin and the jaw, last for about 18 months, occasionally about 2 years. So it's all a little bit dynamic. Yes, they need to be redone. I don't think that's a disadvantage. I mean, yes, we're talking about a repeated cost over time, but this goes back to the adaptability that I spoke about, that actually our perception of our own face changes with time, changes with hormones, changes with diet. And I think putting you in a situation where actually we go, well, let's book in 18 months and we reassess. Some people say, actually, I'm really happy. And yes, the lip filler's gone, but we've ticked the box and we're good. We don't need any more. Or some people will come back and go, I want the same, maybe a little bit bigger, maybe a little bit different shape. And I think having a check-in at that point is just really nice. Yes, it is a repeated cost, but realistically, if we're looking at a couple of £100 every 18 months, it's a lot more affordable than surgery. It's something that you can plan for, account for, and it gives us a chance to play a little bit and experiment and make things work.
It's more dynamic. It can change with how you're feeling.
Absolutely.
Yeah. Renting instead of owning.
Yeah, a little bit.
Leasing, like the car leases.
Yes.
So what would you do? Okay, so we've had our consultation. We've looked in the mirror. We've spent 45 minutes talking. You've drawn all over my face, and I say, yes, I want some treatments.
Yeah.
But I'm needle-phobic. How do you handle someone like that?
Do you know what? The vast majority of patients that come to see me have some kind of issue with needles. So firstly, it's fine. After our consultation, I will not touch your face. We'll take pictures with the drawings, and then I say you need at least a week to think about it. So that's one thing. Mm-hmm. That's following Royal College of Surgeons guidelines at the moment of saying actually people need thinking time. So I very much stick to that. I do not do the first treatment on the same day as our consultation. The next thing is that someone who's needle phobic, we find out what works for you. Does that mean you have some headphones on and you're playing music on? Does that mean you have a friend in the room that chats with you? Do you want someone to hold your hand while I'm doing the procedure? Do you want to have your eyes closed throughout? We do a lot of things to make people comfortable. Also, it's a knowledge that if you faint, if you feel really faint and you're going to faint, that's also okay. I've had people faint on me before. It's not a problem. It's just something that we work with. And it's a lot of people get into their own heads about it. I've had some needle-phobic patients that are crying during a treatment. I've had some that feel dizzy. I've had people that faint. I've basically had it all. So we find out what works. If the actual thing is, do you know what, I just really don't like needles, I can give you a needle and we just actually put a needle into the hand together or into the arm and go, do you know what, this is what it feels like. And then we put some numbing cream on that reduces the sensation of a sharp needle, and we do it again. And we can work together to actually get you used to the feeling of a needle before we even go near your face. So we can do it together, watching it, and it's a bit of some psychotherapy at the same time, but it works. And basically, there is nothing that's going to frighten me off. So it's about whether or not, if you want that treatment enough, it doesn't matter how phobic you are, you're going to do it. And it's about making someone as comfortable as possible through that process.
So is it the same as having an injection in your arm or a blood test? Is it the same kind of sharp scratch, or is it a different sensation?
There are a couple of sensations, and it depends on the treatment. A blood test, the needle is, in my view, whopping. It's a really big, sharp needle, and it's something that you feel. The needles that I use are the smallest available on the market, almost more like a little bee sting kind of feeling, a little sort of mosquito bite feeling, rather than I'm having a blood test. It's tolerable. And a lot of people don't need anesthetic, but actually, if we're doing face, especially if we're doing things like lips that are sensitive, we use numbing cream. For people that are really pain conscious, I can do numbing cream and then inject a local anesthetic. And then we do a procedure. The fillers that I use all have anesthetic in them as well. So once the filler is in, they start to release pain relief, which is good. Some of the procedures I have to use what's called a cannula, which is, it's not a needle. It's a blunt needle, effectively. And what I use those for is if we're doing big sort of structural work, it means I only need to make one entry point into the skin. And for example, doing the jaw, we do one entry point at one side, and I can treat the entire side of the jaw using one tiny entry point rather than repeated injections all the way. And this special needle is not painful, but you can feel something sliding on underneath the skin. So that can be uncomfortable.
Yeah.
Or the internal sound, just like you can hear, if you scratch your own head, you can hear that sound in your head. So we can use vibration techniques, or even just flicking the jaw while we treat. Just detaches the mind from that treatment and it makes it more comfortable.
Nice.
Yeah, that's really interesting. I remember I had some fillers a few years ago, 5 years ago, and as my very first step in transition after getting my hormones. And I remember a sort of crunching sound as the needle went in. It was odd. It was like walking on gravel, something like that.
It's quite a disconcerting sound and a disconcerting feeling. And one thing is accepting, do you know what? You are going to hear sounds. You're not asleep. You're not sedated during this procedure. You're awake. We're talking, and you are having a medical procedure. So you are going to feel something. You are going to hear something. But also, using things like the flicking technique works really nicely for that kind of gravelly, crunchy sound. The local anesthetic, having music on. I also just don't shut up, really. I keep talking. So I will talk to these people who are sitting on a bed, and we'll have a conversation. I encourage people to talk to me even while I'm injecting. I don't mind a moving target. It's fine. And so
That's great.
it's dynamic and we have fun. And all of that puts someone in a position where, okay, yes, you're having a procedure, but you know what? It's not as bad as a blood test.
Yeah. Whilst you've gone over a lot, are there any other things that you really, really wish a patient knew before they came to you?
I always encourage patients to do their research. I'm very transparent about the products that I use, the services that I provide. I think knowledge is power when it comes to these things. I have to say the trans community are really good at research. They're good at talking to each other. They're good at going, oh, actually, I've tried this, and they talk and collaborate, which is great. I'd like to see more of that for the patients that come to see me. I don't know, a lot of the time I actually wish that they came to see me sooner. There are some really, really easy things that we can do that change somebody's entire perspective of their own face. Things like lips, things like, actually, do you know what? I think the most important thing that I've done for people is chins. People they don't consider their own face. They don't consider their chin, which is the picture frame. It's the structure. It's the final thing that people see when you sort of close your eyes. It's the shape of the face drawn by the chin. That can be a 10-minute procedure, and it can be completely life-changing, looking at yourself in the mirror and just feeling different. So I want people to look at their chins, basically. I want people to think about it and think about their face, and don't overcomplicate it.
The chin procedure, is that for trans femmes, trans mascs, and what exactly is it?
So it's chin filler, and actually we can use that for masculinizing or feminizing. Everyone's chin is different. So for feminizing, we make the chin a little longer, we can make it rounder, smoother looking. And for masculinizing, we make it bulkier, we make it squarer, we can make it wider, stronger. There's so much you can do with the chin. And again, the results are instant. Swelling is minimal, bruising is minimal. It makes such a difference.
So square to oval, oval to square.
Yeah, absolutely.
Okay.
Guys, aesthetics, I think traditionally would probably be, most people would think it's something that a woman gets done, but you treat trans mascs and trans femmes. Would you say it's a fairly even spread, or is it more trans feminine people that come to see you?
Good question. At the moment, I think we're about 50-50. So it's for trans masculine patients, it's all about jawlines and chins and providing a bit of weight to the face. For trans feminine, do you know what? We also do chins, jawlines, maybe a little bit more noses. Definitely the lips is a common thing. I think it's, in my practice, I am probably treating 60% male or male presenting people that come to see me, which is very different, I would say, to the market worldwide, where about 80% typically are female presenting. So I therefore, I think, attract a clientele that are slightly different and have seen my work on things like jawlines and chins rather than your typical Kardashian looking face. And so I think it's a little bit about my marketing and my background that maybe has changed the kind of people that come to see me, because I'm very used to maybe more of the male face, but we do everything.
Do you think maybe also it's because trans femmes have facial feminisation surgery, which is very popular, but facial masculisation surgery is only something that's really coming to the forefront now, and so you offer them something that they can't get anywhere else?
Yes, that too. It's there's lots of uptake in things like chin implants and jawline implants for masculinization treatments. It kind of gives me the creeps a little bit of having a foreign body put in. I think it's very different to shave bits of bone, and I think it's different to remove it. Putting something in that is permanent in the world of surgery has to be really well thought out, really well planned. And I mean, we see it with the whole breast implant sort of fiasco that happened about 8-9 years ago, of all these implants popping and causing issues. Is putting something in that's permanent and expecting it to stay there for 20, 30, 50, 60 years. We don't have that research really to benefit that. I know that once my filler dissolves at the end of 18 months, 24 months, there's nothing left. And so I can prove its safety very easily. So I think as a procedure, it's a lot nicer psychologically to go for than something that's going to be with you for life. And actually, do we know how it's going to react in 50 years? Maybe not.
Oh, that's a lot to think about. What things can go wrong with your treatments?
So in terms of any injectable treatment, anything where I'm breaching the skin, there's a risk of pain, risk of bruising, bleeding, swelling. The main thing that I tell people about is cosmetic dissatisfaction, which is we do a procedure that I think is beneficial, but actually you look in the mirror and go, I don't like that, which is fine. It's something that we can reverse and we can dissolve, and it's not a problem. I only use fillers that I can dissolve in my clinic without the need of any other practitioner. And that just brings you back to baseline again, which is fine. There are more serious complications with fillers. And that's where if dermal filler goes into a blood vessel, and now that can impact blood supply to the face. If missed, can be devastating, can cause parts of the skin to die. And we see these horror stories all the time of people having this mist, and it's called vascular necrosis. And it can be devastating. Now, touch wood, I've never had that. The research shows that these procedures, if performed by doctors, the risk is incredibly low. But also, it's, as a doctor, I know what the skin is meant to look like. I know what it's meant to feel like. And if I am worried during a procedure that I may have hit a vessel, I will just dissolve it. And obviously, I don't charge the person for anything we've done that day, but I will just dissolve it. I will go on the side of caution with this. I've never had to do it, but it is a risk. And this is why there needs to be more regulation in terms of who's doing these procedures, because I've had to deal with the complications of that being missed by other people. And that's also in my NHS work, that I've had to deal with someone coming in who's had some filler put in and it's impacting blood supply, and it can be a disaster and people die from it. And so it can get serious very, very quickly. But thankfully, touch wood, we've been good so far.
Is the risk related to the skill of the person doing the work, or is it just a natural part of someone's physiology?
A bit of both, to be honest. There is a risk of who's doing it. So there are so many different layers of skin and sinew and blood and before we get to bone. So just from here to here, within the jawbone, we're talking 3-4 layers. So if we're injecting the wrong layer, and you do that just by feel of the needle, the sensation of the syringe in your hand will dictate where you are. If someone isn't well practiced or well versed in that, or they're stressed and they're nervous, how do they know where they are is one thing. Having a good knowledge of anatomy, say we're doing temple filler, your temporal artery, I mean, everyone can feel it just pulsing away there. We don't want to be hitting that. And it's, again, knowledge of that and knowing where to look. But there are also riskier parts of the face with blood vessels that don't run in a normal way. The nose typically is more risky. So especially when we look at the nose and under eye area, there is a risk if that filler goes into a blood vessel of making someone blind. And so again, it's awareness, it's physiology, but it's also practitioner-led.
Okay, we're nearly there, Doctor. Now, Ollie, thank you so much. Just one more thing. On your website, you say you strive for natural-looking, subtle but noticeable results. Have you ever had to turn someone away because they want something that's too outlandish, or you don't think it would look good on them? So if I came to you and said I wanted a trout pout, what would you say to that?
A what? Can you describe that?
You're not familiar with the trout pout? Oh dear.
No.
It's a good question. I do turn away a lot of people. I have to say, I will not do a procedure that I don't think is benefiting someone. I am very much a believer that things need to be natural looking. It doesn't. It's not really a judgment on other people's work, but it's more, I want the people that come to see me, when they leave, I want them to look good. I don't want them to look fake. I don't want other people to look at that person's face and go, you've had work done. I think the best examples of my work is the work that people just go, do you know what, that person looks really good. I don't know what it is. They just look really good, or they look different. I do turn people away, and I will have a very frank discussion with those people about goals. Sometimes it's just unrealistic expectations as well. Sometimes, actually, some patients need to see a therapist and not an aesthetic doctor. And I've got some excellent links with therapists, and I will send that patient to them. And I go, we need to have a discussion about your relationship with your own body and your own face before we even go near a needle. It's a difficult conversation to have,
I bet.
but it's so, so important to realize in the world of dysmorphia, actually, what is an expected level of wanting to change your face, and what's an unhealthy relationship with you and your body. And if people need therapy, they need therapy. Okay, I don't make money from it, but it's not about that. It's about a patient and getting the best for them.
So if I show up tomorrow and say, look, I want you to go all the way, give me that 5 mil needle, you would say, please go and get some help elsewhere. Here's a card.
Yeah, we might just go, let's break this down a little bit and reassess.
Well, thank you, Dr. Oli. Your full name, by the way, for the benefit of the listeners, is Dr. Oli Curwen.
Yes, that's right. But otherwise, it's just droli.co.uk.
I like it. It rolls off the tongue. Thank you so much for making me tingle in anticipation. I can feel the pinpricks right now. And we'll look forward to seeing you again, hopefully.
Yes, definitely. Thank you so much for having me on. It's been a real pleasure.
No, the pleasure is all ours. And we're off now, so I'm going to Google some images of trout pouts to educate Phoebe.
Thank you very much.
And Phil Mitchell.
And Phil Mitchell, yeah. Phil Mitchell with a trout pout. Now, there's an image.
Bye-bye. Hope you have a wonderful rest of the day.
Have a lovely Friday. Bye now.
Bye. What a great interview.
I know. And he's really, really nice, isn't he? I want to get down there and catch up in person. Down there to London.
Up to London.
Up there.
I want to get up there.
Yeah.
What did you take from that interview?
Well,
Favourite bits?
Look, there's so much good stuff, but I think the most important was his warning about choosing an aesthetics provider. You know, if you can walk away with the training in 20 minutes, which sounded pretty darn attractive to me, and start applying fillers, maybe even to yourself, don't, and make sure the person who's doing it to you has preferably a surgical background.
Yeah, that would be good.
Yeah, especially given what can go wrong without a very thorough understanding of the anatomy of the face.
I love the fact that you got into aesthetics as a side hustle and just ended up loving it.
Yeah, yeah. Although it does make me think that we need to add a question to all of our interviews with surgeons. What was your side hustle?
Absolutely. I also like the fact that he references that you can't make features on the face smaller, but you can make them appear smaller by changing the way the light reacts on the face. That, I'd like to learn a bit more about that.
Yeah. Well, he offers cheaper treatments for trans people.
Right now, that is amazing.
Yes. Yeah, especially because we're having to DIY just about everything.
Yeah. And I like the way he mentioned that it can go side and side with FFS. Facial surgery is the broad strokes, but what he does can be the fine tuning.
Yeah.
Yeah.
Yeah, that's true. Yeah, it's a really good idea to keep that in mind when thinking about your overall journey with facial feminizing surgery, or if you're looking for masculinization, because there are some procedures performed by surgeons there as well. Maybe have both consultations.
Yeah.
Go see both types of practitioners and build your own big picture.
And people need to remember that the shape of the face is drawn by the chin. It's the most effective starting point for many of us, whether you're FTM or MTF.
Right. That's a very good point. So that's it for this episode of the Joy Tuck Club.
Yeah.
We are going transatlantic in the next. I know, exciting. Talking with WPATH's President-elect, no less, Dr. Lauren Schechter, one of the USA's foremost experts on transgender surgery, and someone who has a very big job ahead of him. Be sure to look out for that one in about 2 weeks' time.
That will be our 9th in the gender-affirming care series.
Yeah. Wow. They are stacking up, all leading into the book. For our listeners, if you've missed any, go back through the catalogue and have a listen. There's so much information in there.
Is.
It's all packed in with interviews with transpiration specials and, of course, our Season 1 silliness.
Remember that?
Oh, I missed that. Here's the news.
Need to get back to that.
Absolutely. So thank you, listeners, for tuning in, being part of our community. If you want to connect with us further, please visit our website at redandfreckles.com, where you can keep up to date on all things red, and some of them freckly.
You can also follow us on Blue Sky, Threads, Instagram and Facebook, but not Twitter.
Never Twitter.
We use the handle @2damptrans on all platforms, and you can DM us if you have any questions or topics that you'd like us to discuss.
Please don't forget to subscribe and rate us on Spotify, Apple, YouTube, or wherever you listen to podcasts. We'd be very grateful. We're on all the popular platforms now.
And as always, even on some of the unpopular ones.
We do appreciate your feedback and support, so please subscribe and rate us.
Well, unless you don't like us.
No. No.
So until next time, remember, you are valid.
You are beautiful.
And you are transcending boundaries.